Menopause and subsequent estrogen deficiency have been implicated in the etiology of overactive bladder in elderly females. Recently, attention has focused on ischemia of the bladder as a common cause for lower urinary tract symptoms, including OAB. In the present study, we investigate the effect of ovarectomy and estrogen replacement on bladder blood flow with an increase in bladder volume. Virgin ST rat randomly received sham operation, ovarectomy, and ovarectomy plus estrogen replacement. 4 weeks after surgery, we measured bladder blood flow and carried out cystometry in awake rat. Method of bladder blood flow. Rats were anesthetized with urethane and the anterior bladder was exposed. Catheter implantation was carried out and saline was infused at a rate of 4 ml per hour. A laser spec blood flow imager was used to measure blood flow. Cystometric study was also carried out in awake rat 4 weeks after surgery. 3 days before cystometry, rats underwent catheter implantation. Saline was infused at a rate of 10 ml per hour. Result of bladder blood flow. When bladder volume was 0 or 0.1 milliliter, bladder blood flow was significantly decreased in OX groups, ovarectomy group, and estrogen replacement. This decrease was suppressed by estrogen replacement. When bladder volume was 0.2 or 0.3 milliliter, there is no significant difference in bladder blood flow. Result of cystometry: ovarectomy induced bladder hyperactivity, and estrogen replacement is estrogen replacement restored bladder hyperactivity. This bladder hyperactivity was characterized by decreases in micturition interval and bladder capacity. Ovarectomy significantly reduced bladder blood flow and induced bladder hyperactivity that was characterized by decreases in micturition interval and bladder capacity. Estrogen replacement restored bladder blood flow and restored bladder function to normal. Since bladder ischemia is known to cause functional and structural alterations of the bladder, decreased bladder blood flow and consequent ischemia may play a potential role in the development of overactive bladder in elderly women. Thank you for attention.
We're now open for questions.
You're saying bladder blood flow, but I think it's bladder blood volume. What you measured is not dynamic, or is it? I'm not familiar with your way of, I do not near-infrared measurements of blood flow or variation, but what you do is a static. Your units that you give, which are reported to be flow, are milliliters or volume per bladder tissue.
Bladder tissue. One more, please.
If I look at the vertical axis of your graphs, then the unit is volume per bladder tissue, which is a volume. Volume, there. Milliliter per minute per 100 gram. Per minute. Okay, that is a dynamic measurement. Excuse me. That is excellent. Good.
Thank you.
I'm Kyuji from Osaka University. So you found the volume reduction after ovariectomy. So have you checked the histology of the bladder and any difference compared with sham rats? Have you checked the histology of the specimen of the bladder?
Histology?
Yes. Have you checked the bladder tissue?
Yeah. But
So did
there
you
is
find
no-
any difference?
No significant difference.
And why do you think that what would you think the mechanism is to explain why it's only at low bladder capacity?
I did not evaluate the mechanism of decreased blood flow in present study, but the recent report suggests estrogen activate enos expression in vascular endothelium. Therefore, as a result of estrogen deficiency, NO production decreases in the endothelium. So, vasodilatation of estrogen may decreases in estrogen deficiency.
Thank you.
Thank you.